Welcome to our channel. Today we're diving into an important topic, the types of people who should never get plastic surgery, according to top plastic surgeon Dr. Charles Lee. We'll be talking about who plastic surgery is and right for. Plastic surgery can be life-changing, but it's not for everyone. Let's find out who should avoid going under the knife. The first type of person Dr. Lee advises against plastic surgery is someone struggling with body dysmorphic disorder, commonly known as BDD. Now you might be thinking, Dr. Mike, what exactly is body dysmorphic disorder? It's a mental health condition where someone becomes fixated on a perceived flaw in their appearance, often to the point where it disrupts their daily life. This flaw might be minuscule or even non-existent to others, but to the person with BDD, it's all they can see, dominating their thoughts and emotions. They might spend hours obsessing in the mirror, constantly comparing themselves to others, and feeling deep shame and anxiety about their looks, which can lead to severe emotional distress. Now you might think plastic surgery sounds like the perfect solution, right? Fix the flaw, fix the feeling. Unfortunately, it's not that simple. The reality is far more complex. People with BDD often have unrealistic expectations of what surgery can achieve, believing it will solve all their problems. They might imagine that a single procedure will erase all their insecurities and suddenly make them happy, successful, and loved, transforming their entire life. But the truth is, surgery changes the outside, not the inside. It doesn't address the underlying issues that cause the distress. If the root of the problem is a distorted self-image, surgery might only provide temporary relief, if any at all, and the dissatisfaction often returns. In fact, it can sometimes even worsen the BDD, leading to more intense feelings of inadequacy and disappointment. The person might become fixated on a new perceived flaw or feel like the surgery wasn't good enough, perpetuating the cycle of dissatisfaction. That's why Dr. Lee emphasizes the importance of addressing the underlying mental health condition first, before considering any surgical options. Instead of going under the knife, Dr. Lee strongly recommends seeking help from a qualified mental health professional who can provide the necessary support and treatment. Therapy, particularly cognitive behavioral therapy, CBT, can help individuals with BDD challenge their negative thought patterns, develop healthier coping mechanisms, and build a more positive body image, leading to lasting improvements. Through therapy, individuals can learn to see themselves in a more balanced and realistic way, reducing the obsessive focus on perceived flaws. Remember, true beauty comes from within. It's about how you feel about yourself, not just how you look on the outside. Addressing the psychological roots of body image issues is crucial for long-term well-being and happiness, leading to a more fulfilling and confident life. Let's talk about control freaks and perfectionists. You know, those of us who have a very specific vision of how things should be. Now, there's nothing wrong with wanting things a certain way, especially when it comes to our own bodies and appearances. But when it comes to plastic surgery, a little flexibility goes a long way. It's crucial to understand that not everything can be controlled down to the last detail. Dr. Lee cautions that individuals who are absolute sticklers for detail, who expect nothing less than absolute perfection, might find the experience of plastic surgery more stressful than satisfying. The quest for perfection can sometimes lead to unrealistic expectations. See, plastic surgery is an art as much as it is a science. It's about enhancing what you already have, not creating something entirely new. Just like an artist works with a canvas, a surgeon works with the natural contours of your body. It's a delicate balance of skill and creativity. It's about working with the natural contours of your body. And just like every masterpiece is unique, so too are the results of plastic surgery. No two outcomes are exactly the same, even with the most skilled hands. While skilled surgeons like Dr. Lee strive for the best possible outcome, there are inherent limitations and variations that occur naturally in the healing process. Think of it like baking a cake. You can follow the recipe perfectly, use the finest ingredients, but the final cake might still have a slight imperfection. Maybe it tilts a little, or the frosting isn't perfectly smooth. You can follow the recipe perfectly, use the finest ingredients, but the final cake might still have a slight imperfection. Maybe it tilts a little, or the frosting isn't perfectly smooth. It's still a delicious cake, right? The same goes for plastic surgery. There might be slight asymmetries, minor variations in scarring, or subtle differences that are barely noticeable to the average person. Maybe it tilts a little or the frosting isn't perfectly smooth. It's still a delicious cake, right? The same goes for plastic surgery. There might be slight asymmetries, minor variations in scarring, or subtle differences that are barely noticeable to the average person. It's still a delicious cake, right? The same goes for plastic surgery. There might be slight asymmetries, minor variations in scarring, or subtle differences that are barely noticeable to the average person. But to someone fixated on absolute perfection, these minor variations can become major sources of stress and disappointment. But to someone fixated on absolute perfection, these minor variations can become major sources of stress and disappointment. So, if you're someone who struggles with accepting slight imperfections, plastic surgery might not be the right fit for you. It's important to have realistic expectations and understand that the human body is not a machine. Embracing the beauty of imperfection is key to a healthy relationship with yourself and with any surgical procedure. So if you're someone who struggles with accepting slight imperfections, plastic surgery might not be the right fit for you. It's important to have realistic expectations and understand that the human body is not a machine. It's important to have realistic expectations and understand that the human body is not a machine. Embracing the beauty of imperfection is key to a healthy relationship with yourself and with any surgical procedure. Embracing the beauty of imperfection is key to a healthy relationship with yourself and with any surgical procedure. Embracing the beauty of imperfection is key to a healthy relationship with yourself and with any surgical procedure. Now let's talk about expectations. We've all seen those movies where someone goes under the knife and emerges looking like a completely different person, right? Well, here in the real world, plastic surgery doesn't work that way. Dr. Lee stresses that it's crucial to have realistic expectations about what plastic surgery can and cannot achieve. Think of plastic surgery as a way to enhance your natural features, not completely erase them or transform you into someone else entirely. It's like using makeup. The right makeup can accentuate your eyes, define your cheekbones, and give you a healthy glow, but it doesn't change the fundamental structure of your face. Similarly, plastic surgery can refine your nose, reshape your abdomen, or enhance your bust, but it won't change your underlying bone structure, height, or body type. And it certainly won't magically solve all your problems or make you look exactly like your favorite celebrity. Dr. Lee has had consultations where patients come in with photos of celebrities, expecting to walk out looking like their doppelgangers. But the reality is, we're all unique individuals with our own unique features. Trying to morph into someone else not only sets unrealistic expectations, but can also lead to disappointment and dissatisfaction with the results. Remember, plastic surgery should be about enhancing your natural beauty, not erasing your individuality. It's about feeling more confident and comfortable in your own skin, not trying to fit into someone else's mold. Now let's talk about some medical factors that can make plastic surgery risky or even impossible. Understanding these factors is crucial for anyone considering undergoing a procedure. Dr. Lee emphasizes that certain medical conditions can increase the risks associated with surgery, and it's crucial to be upfront and honest with your surgeon about your medical history. This transparency helps the surgeon plan the procedure more effectively and take necessary precautions. One such condition is being an easy bleeder. This is a significant concern that needs to be addressed before any surgical procedure. This means you tend to bleed excessively, even from minor cuts and scrapes. Such a condition can complicate the surgery and the recovery process. It could be due to a genetic predisposition, certain medications like blood thinners, or underlying medical conditions. These factors need to be carefully evaluated by your surgeon. Why is this important for plastic surgery? Understanding the reasons behind these precautions can help you appreciate the complexity of surgical procedures. Well, excessive bleeding during or after surgery can lead to complications, increased scarring, and even life-threatening situations. This is why surgeons need to be fully aware of your bleeding tendencies. Surgeons need to be aware of your bleeding tendencies to take appropriate precautions and minimize these risks. This might include adjusting surgical techniques or using specific medications to control bleeding. Another factor that Dr. Lee stresses is smoking. Smoking has far-reaching effects on your overall health and can significantly impact surgical outcomes. We all know smoking is bad for our health, but did you know it can wreak havoc on surgical outcomes? The chemicals in cigarettes can interfere with the body's natural healing processes. Smoking constricts blood vessels, reducing blood flow to tissues, which is crucial for proper healing. This reduced blood flow can lead to several complications. This can lead to delayed wound healing, increased risk of infection, and more noticeable scarring. These complications can significantly affect the results of your surgery, and it's not just cigarettes. Other forms of smoking can also be detrimental. Vaping, marijuana use, and even secondhand smoke can have detrimental effects on surgical recovery. These substances can introduce toxins into your body that hinder the healing process. If you're considering plastic surgery, Dr. Lee strongly advises quitting smoking altogether, ideally several weeks before and after the procedure. This gives your body the best chance to heal properly. The same goes for alcohol consumption. Alcohol can have several negative effects on your body, especially when preparing for surgery. Alcohol thins the blood and can interfere with anesthesia and pain medication. This can complicate both the surgery and the recovery process. It's best to abstain from alcohol for a significant period before and after surgery to minimize risks and promote optimal healing. This will help ensure that your body is in the best possible condition for recovery. Remember, your health is your wealth. Taking care of your body before and after surgery is essential for achieving the best results. Being honest with your surgeon about your medical history, lifestyle choices, and any medications you're taking is crucial for a safe and successful surgical experience. This transparency can make a significant difference in your surgical outcomes. Thanks for watching. If you found this video helpful, don't forget to like, comment, and subscribe for more informative content. Remember, plastic surgery is a personal decision, and it's important to choose what's right for you. Consult with a qualified and board-certified plastic surgeon to discuss your goals, concerns, and whether you're a suitable candidate for the procedure.